Yeah, it's really a pleasure for me to introduce Avi Weiss, who's a good friend of mine. Avi is a chaired professor at Bar-Ilan University, the Department of Economics, and he's currently head of the think tank at the Taub Center. The Taub Center is a nonpartisan think tank. I'm on the board of the Taub Center, and I thought, and that's why I'm very grateful for Avi to take the time to spend with us. I thought he'd be of great interest to this group of economists and finance planners. I'll just tell you the Taub Center has a wealth of information on socioeconomic studies that they've done about Israel that are really interesting that I'm sure Avi will talk about. Just a word about Avi. I met Avi about 40 years ago at the University of Chicago. He was one of the best, if not the best, graduate student I've ever had. He was my teaching assistant. I immediately hired him to help me teach a course. While he was writing his thesis at the university, he worked at my consulting firm, Lexicon, and he wrote a thesis, a superb thesis. He had 2 Nobel laureates on his committee. Gary Becker chaired the committee, and George Stigler was on it. As those of you who know who've written a thesis and try and get committee members, it's not so easy to get a Nobel laureate, but a potential Nobel laureate. But these 2 people were quite willing to join in. After getting his thesis and submitted and getting approved, he made Aliyah in the late 80s to Bar-Ilan. He has been there ever since. He's had written many papers, wide-ranging research. He's served in many positions. He's was head of the economics department at Bar-Ilan, and he's also served on many government commissions. So many I can't mention them all. I just mentioned 2. He participated in was on the committee of the famous Trachtenberg Commission, which had a big influence on changing protectionist policies in Israel. And he served as the deputy director of the Antitrust Bureau in Israel. Just this past year, Marker, which is the equivalent to the Wall Street Journal in Israel, named Avi as one of the most influential Israelis influencing public policy. And obviously, as head of the Taub Center, he is very well situated to serve in that role. So with that, I turn it over to Avi. I did mention to some of you on the call when we're getting started also that Avi is a chazan, but he's not going to lead us in services right now. Instead, he's going to tell us about something we all have a religious passion for, which is economics. So go ahead, Avi.
Thank you so much, Dennis. You always flattered me a lot, and I thank you very much for it. Dennis has been incredibly instrumental in everything that I've done since I started graduate school at the university, and I can't thank him enough. He was also, when he mentioned that thesis committee, he was the 3rd member on that thesis committee. So again, Dennis, I have so much to thank you for over so many years. So the center has been around for quite a while. We've been around since 1982. We're moving on 40 years now. And it was started at the request then of Menachem Begin, who saw a need of a Brookings-type institute inside of Israel that would not be dependent in any way, in any manner, on the Israeli government in terms of funding or in terms of what subjects to research, but would be able to inform the government about what was going on and would be able to influence decisions. It was created to be nonpartisan. It has been nonpartisan for the past 40, for the entire 40 years. We don't lean left, we don't lean right. We try to give a fair view of what's going on. We base ourselves very, very much, very heavily on data. We want to make sure, our agenda is to make sure that decision making is made based on real analysis and not based on just submission. And we cover everything socioeconomic. We don't touch politics. We don't touch defense in Israel, but everything else, whether it's health, education, welfare, macroeconomic policy, labor markets inside of Israel. We basically look at all the issues that are important to Israeli citizens in terms of their livelihood, in terms of the quality of their lives, and that's basically what we look at. So we have a huge, our researchers, many of our researchers are full professors at different universities who will spend a couple of days a week doing research for the center in these subjects. They're important from a social perspective inside of Israel. We are very interdisciplinary, many economists, but also sociologists, social work, education. We have people, a demographer who make sure that we're doing all our analyses properly. And we really make sure that we do everything professionally. We also have, of course, younger researchers who work full-time inside the center, people with either working towards their PhDs or who have finished their PhDs and doing research in the different areas that we cover. We, as I say, make sure to be nonpartisan, and the result of that is basically all of the political parties in Israel come and consult with us. They come and they want to see our latest research. They want to hear what we found. They can agree, they cannot agree. I'll present the same information to people from different parties. Some will love it and some will hate it, but that's what the data are saying, and therefore that's what we show them. It was sort of difficult to choose and pick and choose, in this short time we have together, what to show. So what I'm going to basically show you is a little bit about what happened inside of Israel in terms of this illness and how it's divided up inside of Israel, what occurred, how it's different from other countries. And then we're going to go a little bit into the macro view of what has happened inside of Israel, what's expected going forward, and a little bit about the labor markets. Feel free to ask questions along the way, because this is actually a fairly homogeneous group in many respects. But I'm sure you all have questions and things that you want to understand better. And I'll be happy to give you answers to whatever questions you have. If I don't know the answer, I'll just make something up anyway, and just try to make it so you can't really tell. So we'll see how that goes for me. So I'm going to share my screen, a presentation that I put together. Are you seeing a single screen? Or are you seeing a double screen?
Single screen.
Okay, super. Okay, so that's what I called it. I called it Israel in the wake of COVID-19. And let's just kick it off. So this is the number of confirmed infections per 100,000 inside of Israel. And what you're going to see, this is going back to when it pretty much all started. It started in March, actually, in most countries. It started earlier than that, of course, in some places. But it started getting, a big issue a little bit later than that. And this is going until yesterday's data. I don't have today's data in there yet, but this is taking you up until yesterday. And what you're seeing is the number of confirmed cases. Now, what's interesting, obviously you had the first wave that occurred very, very early. In lots of places, Israel was very, very low. The United States was actually a lot higher than Israel was. Then you had the opening up of the economies. And in Israel, the economy was opened very, very quickly and very expansively. The result of that was you had what started happening in July, the increase, but took off completely, incredibly, in September, when the school system was opened up and then shut within a 2-week period because of the fact that things got completely out of hand in terms of the numbers of people who came down infected. So this was the second closure inside of Israel, occurred in this area over here. I assume you're seeing my mouse. Occurred in this area over here, which is much earlier than in pretty much any other country. That second wave started in Israel really, really quickly, really, really early. And that was a result of the way in which things were opened and the result of the way in which the population acted. And that was the first wave. It happened about a month to a month and a half later. It started happening in other countries. The countries that are inside this graph are the countries of the OECD countries with the top 20 number of confirmed infections per 100,000. Okay, so this is a choice of the top 20. You can see where the United States is, but you can see the third wave that happened at the beginning of this year. Again, a very, very large wave. And then you can see what's happening now, that the numbers have come down very, very significantly. And today, the number of confirmed infections per day in the entire population is somewhere around 100, which means about 1 person per 100,000. Okay, so the numbers are much, 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 much lower than they were going into this. If you take a look at the cumulative, so Israel, you can see, again, in this area, it was leading the world, unfortunately, in the number of confirmed cases per 100,000. Then there are other countries that surpassed it. You had that third wave, where Israel again moved up very, very quickly. But today, it's basically leveled off. there's very, very small addition to the number of people who are coming down ill every day. Next Friday is Lag BaOmer. There are people who are concerned about that. Lag BaOmer is a day when many, many people go up to an area called Meron in the north of the country, and in particular the ultra-Orthodox communities will go up there, and you could have many hundreds of thousands of people up there. And the question is, what the result of that's going to be. But the truth is that there was concern both about Purim and about Pesach, about Passover, and those didn't bear out anything. You didn't have any kind of infections that occurred as a result of those holidays. So therefore, there's a lot of belief that we are, at least for now, past the pandemic to a large extent. Not past it, but at least it's a lot less. As of this week, as of Sunday, people are allowed to go outside without masks on. Inside, you still have to wear them, but outside, you don't have to. If you take a look at what's happened to mortality, so this is plotting mortality over different 2-year periods from the beginning of the century. And what you're seeing in general, well, first of all, you see this is by week number in the year. Obviously, there's far less mortality in the summer than there is in the winter. That's in general true because of weather issues. And therefore, you do have, the early beginning of the year, the end of the year, that's when you have most of the mortality. But you do see the large improvements in health in Israel over time. And this isn't such a long period. This is a 20-year period. You see those decreases in mortality that are happening over time from year to year or from period to period. And you see the beginning of 2020, actually mortality was very, very low. Until COVID hit, mortality in Israel was very low. We'll clean this up a little bit and show you what it looks like in 2017 to 19, those last 2-year or 3-year period. And then take a look at 2020, what was observed and what was expected, either given a 2.5% decrease or a 3.5% decrease, depending on the approximation that we did. Basically, looking at the trends over time and applying those trends to this period. And what you're seeing is that there wasn't an increase. Now this is mortality, not necessarily from COVID, because they say it's from COVID. You don't really know what people died from. You do know that the person had COVID, but you don't know what would have happened to them otherwise. And therefore, this is all mortality inside the country, not just from that. And you take a look and you see that in the early periods of COVID, there was some excess mortality compared to relative to what was expected, but that the huge bump came in the summer, and it came in particular in September and October. And that's when you had that really, really large increase in mortality. And when we estimate how much excess mortality there is inside of Israel, you find that it's pretty similar to the numbers that you're seeing that is being defined as COVID. In other words, when you run the regressions and you try to figure out how much excess mortality there is, you do find that the numbers that are being said as mortality from COVID are fairly close to the numbers that are coming out of the models. Obviously, if I were to extend this to 2021, you would see that the beginning of 2021 again had a lot of excess mortality inside of the country. Now, just looking at the mortality numbers compared to the infection numbers, you see that mortality in Israel was fairly low relatively. And this has to do to a large extent with two issues. One is the age distribution inside of Israel. Israel is a very young country compared to most other developed countries, developed countries certainly. And we have, if I were to just give you an example, in the Jewish population, about 50% of the population is below the age of 18. So we are a very, very young country, and we know that COVID was particularly dangerous, particularly harmful to older populations. So if you were to take, that was one issue. The other issue is, even if you control for the age distribution, the percentage of elderly who came down sick after that first wave was very low. The people who were coming down sick in Israel were much younger populations than inside of other countries, even controlling for the different age distributions. So what you're seeing is if infections in Israel were proportional to its age structure, in other words, if in fact you have 50% under 18, if that 50%, if 50% of those who are sick were under 18, and et cetera, and divided according to the age distribution, you would have had more deaths than you actually had by about 1,000. And that if it were proportional to the OECD's age structure, as I said, Israel is a very young country, young population, then you would have had another 3,000 over 3,500 over what actually happened. In other words, you would have had twice as much mortality as you actually did. So Israel, to a large extent, protected its elderly population fairly well, and the result was that you had, and also the hospital system did a very good job of treating people. The other thing is that if you take a look at the effect of, so that was a lot of the good news. A lot of the bad news comes over here. If you take a look at the effect of the number of confirmed cases inside of Israel, how many people came down sick, then had we done as well as other countries did, and these are the other countries here that we've put in, the number of deaths inside of Israel would have been much lower. In other words, New Zealand did an incredible job, unbelievable job. So did Australia in keeping the number of ill low. Had the number of ill in Israel been proportional to that in New Zealand or in Australia, we would have had less than 100 people who had died from COVID. As a result, as it is, we had 3,500 people, and so it is with other countries here. Even Sweden, that left things fairly open and didn't close down things at all inside their country. We actually would have done better with the number of confirmed cases they had than the number that Israel had. In other words, the numbers in Israel with respect to the people who came down sick was incredibly high, incredibly high. This partially has to do with government policies, government decisions, and also partially has to do with behavior of the population. And when you talk about behavior of the population, we're going to have to talk about which populations. So now I'm going to just show you this with respect to the percentages. So you have there on the left-hand side, the share of the population of the Arab Israeli community is about 21%. The ultra-Orthodox, which is the Haredi population, that's about 12%. And the rest of the population, 67%. And if you take a look at the age distribution differences, just the age distribution, then you expect the elderly to be the ones who will be hospitalized more. Had the incidence of illness been proportional to the age distribution, only about 15.5% of those in the hospitals would have been from the Arab population, and only about 6%, because they're so young, from the ultra-Orthodox population. And if you take a look at mortality, it would have been only about 4%. Unfortunately, that's not what actually happened in reality. And this is the number of infections per 100,000 in 205 different municipalities. Now, this covers 88% of the population inside of Israel. Okay, it's not everybody. The ones that are not included are those places where we could not get precise information. Now, what I mean by precise information is they divided up the country into relatively small areas. And the data we are able to get, not the data that the government has, but the data that we are able to get our hands on will only show a precise number of those who came down sick, those who went to the hospital, those who died, only if there are at least 15 people in that area who came down sick or who died or went to the hospital. If there are fewer than 15 people, they will just write less than 15, and we won't get a precise enough number. So therefore, we limited ourselves to those for which we had the precise number, and we're able to see the number of those who came down ill. Now, what you're seeing here is among the 8 ultra-Orthodox cities. The other thing is we cannot identify in the data, in the government data, who is ultra-Orthodox. We're not identifying people. I can't tell you that, Greg, you're ultra-Orthodox or you're Arab or you're whatever. I do know, however, where you live. And by knowing where you live, I can then take a look at the distribution of the population inside that city, inside of that municipality, and figure out whether it is mostly Haredi, it is mostly Bedouin, it is mostly Druze. I can't necessarily pinpoint exactly who the person is. But when we do that, we have 8 cities that are defined as being ultra-Orthodox in that manner. And all 8 of those cities had higher percentage of infection than any other city inside of Israel. City inside of Israel. You see that the Bedouin were the one who actually suffered the least, although there are those who say that they just weren't reporting a lot of what's happening. You can see that the Arab populations, the Arab Israelis and the Druze, had quite a few more than in the Jewish Arab or the Jewish populations. And you see the Haredi and the mixed Haredi and non-Haredi way above everybody else. Now, when you turn that over and go to hospitalizations, things look very different. And when you look at hospitalization, then you see that the Haredi population is actually not nearly as high as it was before, despite the large number of ill. but that the Arab populations are actually quite high and actually significantly higher than you saw on the previous graph. And the reason this is happening, and the same is true with the Bedouin, who were incredibly low before. And the reason you're seeing this has to do with background information. So the ultra-Orthodox population is particularly young. It's particularly young. There, over half the population is under the age of 16. So therefore, even those who are coming down sick are not coming down sick to a degree that they need to be hospitalized. So those are low numbers. The Arab Israeli population tend to have a lot of background diseases. Israel in general has very, very low incidence of cardiovascular disease, but that's not true in the Arab Israeli population. They have a much higher incidence of cardiovascular disease. They have a much higher incidence of diabetes. They have a much higher incidence of obesity. And all of those things are compounding factors with respect to COVID and have made a lot more of the population that did come down sick end up inside of hospitals. Unfortunately, I can't do this for the number of for mortality, for the number of deaths, because the way that the areas are divided up just don't give many areas that had 15 or more people who died. And therefore, since they don't release that data, I am not able to do that. I understand the Bank of Israel has a new study in which they are able to get more detailed data than what we have, and hopefully they'll be able to come out with more detailed information. So from that background, and maybe it's a bit of a long background, but I think it's important to understand what's been happening. Let's take a look at what's happened to the macroeconomy. So with respect to GDP per capita, GDP per capita in Israel, and we at the Taub Center for years have been focusing on GDP per capita and not GDP, as most people do. And the reason is Israel is growing at about 1.9% per year in terms of its population size. And not to take that into account when calculating what's happening to the well-being of Israeli citizens, well, that would just be wrong. So therefore, even if you hear that that GDP in Israel is growing very, very quickly, it's not growing nearly as quickly when you take a look at GDP per capita. In fact, it's well below the OECD average. But if you take a look at what was happening, the growth was fairly significant over time, somewhere around 1.5% a year, not as high as other places, but still about 1.5% a year, maybe a little bit lower than that. And it was expected to continue without COVID. With COVID, there was a huge drop, obviously, in 2020. And you can see that it brought us back about 4 years to about the level of GDP per capita in 2016. But the growth in 2021 that is expected and the growth in 2022 that is expected are very significant and are basically going to pretty much or almost erase the entire deficit that would have relative to what would have happened. So therefore, we are expecting pretty much full recovery within a 2-year period after this whole thing started, or a 3-year period after this whole thing started. So that's actually some fairly good news. In terms of deficits, obviously Israel for a long time had been lowering its deficit. It got it down to between 1% and 2%. That was outstanding. That's a lot of the reason that Israel has such a high credit rating is that it basically brought its deficit down. I'll show you in a minute what happened to its debt to GDP ratio. But 2018, 2019 were years in which the Israeli finance minister made some agreements with specific groups and gave them benefits that cost the government a lot of money and will continue to cost the government a lot of money. So while Israel had planned on continuing a very low deficit, that's not what ended up happening. 2020 was expected to get to about 4% to 4.5% before this whole thing hit. But in the end, obviously, as a result of what happened and as a result of the very, very large expenditures and the fall in tax revenues, the deficit went up to about 11%. It was expected, by the way, to be much higher than that. But in the end, there was a lot of recovery in the tax revenues, and the increase in deficit was only a little bit above 11%. It's going to stay high this year also. The recovery is underway, and it's doing very, very well for the most part. But there's still quite a bit of unemployment. There's still a lot of people who are getting unemployment benefits that cost a lot of money. There's still assistance to many different groups. And therefore, the deficit is going to continue to be about 8%. And hopefully after that, it will start going down very, very significantly with the recovery. That also reflects, of course, on the debt to GDP ratio. Israel was in a great shape with respect to debt to GDP ratio, being at about 60%, which was really way below most other developed countries. But of course, in this year, it went up to about 72%. Okay, that's that increase that you saw before. Obviously, we spent a lot of money, like all the countries did. In 2021, as a result of continued spending, it's going to continue going up, and over time that'll go down. But you know what? That's really probably not critical, because of the fact that it's still very low relative to other countries, and therefore it's not expected to harm Israel's credit rating. But if those deficits go down, then this will go down along with it. It might take a decade to get back to where it was, but I don't think that's necessarily a bad thing to have your debt GDP ratio to be a little bit high. If you take a look at what Israel did in order to assist its struggling populations, well, we divided the assistance into three parts. One is a fiscal impulse, money that's given to the unemployed, money that's given to the businesses that suffered. That's one type of assistance. Another type of assistance is tax deferrals, where you allow the companies to not pay right now and to be able to have a better cash flow. The third one is guaranteeing loans from banks. Israel was actually pretty good in terms of the immediate fiscal impulse, not quite as high as the United States, which was near the top, but actually fairly high relative to many other developed countries. But with respect to the other two issues, with respect to tax deferrals and guarantees, it actually lagged well behind what was done in many other countries. Now, this is what was allocated. It's not even exactly what was spent, because if you take a look at what was spent and you divide it up by its different areas, so in civilian and healthcare response, most of what was allocated was spent. In Social Security, assistance to people who needed it, most of it was spent, but there was still about 23%, about a quarter, that was not actually spent despite its allocation. When you look at the business continuity, assisting businesses, they actually allocated more, quite a bit more than what was actually spent in the end. And this one is really problematic. It's not a lot of money. I mean, it's 4.6 billion shekel. That's still a lot of money in Israel, but it's not as much as you saw in some of those other issues. But on the other hand, this was the type of money that should have been used for improving its infrastructures. We know that one of the main problems facing Israel is very, very poor infrastructures in terms of roads, in terms of public transportation, in terms of high-speed internet for the north of the country, for Arab villages. And these are things that, while the country was fairly shut down, would have been fairly easy to do to a very, very large extent, and yet a lot of it was not done. Moving over to the labor, you guys should feel free to ask questions, because I'm just going to keep going until you do. Moving on to...
I'll ask a question.
Okay.
When you talked about going back, I have a bunch of questions, but the one that gets immediate to mind is when you go back and talk about per capita GDP, the Haredi community is less productive, I think is a fair assumption. And I think it's the most rapidly growing portion of the economy. Have you ever taken that out and sort of adjusted for the Haredi versus non-Haredi and the per capita growth?
That's really interesting. There are those who, so that's a loaded question. Why do I say it's a loaded question? There are those who would tell you that, yeah, of course, yes, you should separate them because they're by choice, not, for instance, working as much, and therefore perhaps you should be looking at them separately from the rest of the economy. And there are those who will tell you, including in particular the head of my welfare program, who will tell you, no, you can't do that. They're part of the population just like anybody else. And every country has people that will work less or more, and therefore you can't just say, well, they're second-class citizens, don't count them the same as everybody else. So it's really a good question. So yes, that has been done. We have not particularly done that, but that has been done by different parties, in which you can look at it. And obviously, if you do that, you're going to see different numbers. But with that, the fastest growth in labor force participation has been among Haredi women, faster than any other population. And even among Haredi men until 2015, from 2003 until 2015, you had very fast growth in the number of Haredi men who went out to work. Now, it's true that they also have the most children, but there are a lot of children in Israel in general, not just among Haredi. And in fact, if you take a look at population growth, you take a look and divide it across the different parts of the population. Israel's fertility rate is about 3.1 children per woman. Now that 3.1 children has been actually growing, and the growth is not because of what's happening in the Haredi population. And it's not because of the share of the Haredi population. It is mostly because the secular have been having more children. And the secular in Israel and the traditional inside of Israel have increased their numbers. There's a higher fertility rate among the secular in Israel than in any OECD country. So it's a very, very mixed bag. You know, a lot of what's going on the other population, by the way, who have increased their labor force participation have been Arab Israeli women. That's also gone up very, very significantly. Did I answer your question in any way, Dan?
You did, but why don't you go on? We could go into the weeds, but I don't think that's really necessary at this point.
Okay. So if we do look at the unemployment rate inside of Israel, then you do see, and this is, unemployment was redefined this year. Okay, unemployment is usually defined as people who are not working but are looking for work. Okay, so they're participating in the labor force, but they're not working at the time that the unemployment rate was checked. This year, the way that Israel worked things was that everybody who wasn't held on to, who didn't work anymore, was put on unpaid leave. Now, when you're put on unpaid leave, you would generally not be considered unemployed. You're not looking for a new job. You're not looking for a job at all because you have your old place of employment, and therefore you would not consider unemployed in any manner. But therefore they redefined basically unemployment this year as a result of what happened. And that 16.3% you're seeing there, that was at the end of 2020, or actually probably the average for the year. But it actually got up to over 30%. It got up to close to about 33% of the population that was either on unpaid leave or standard type of unemployment. They also included another category, people who left their job because of the disease, because of COVID, and stopped looking for a job because they basically gave up or they went back to get a schooling or whatever reason, they basically stopped looking. So therefore, this number is a very, very wide number. But if you take a look, and in fact, if you took a look at just the standard definition, you would still be somewhere around 4.5% to 5% right now. But if you take a look at what's expected now in 2021, that's going down to about 8%, a little under, and then to about 5.4%. Now that 3.8% was a historical low. It actually had been lower in 1966, but that was the only year in which it was lower than the 3.8%. You know, you're not going to get back there quite that quickly, but you do expect the unemployment rates to go down. Right now, unemployment is still relatively high because of the fact that the government is still paying unemployment benefits. And many young people don't want to go back to work because given what they were doing, working as waiters or whatever it is, you know, the salary they're getting is not higher than what they can get from the government by staying home. And therefore, many of them have not gone back. And that's caused a bit of a problem. Many restaurants are having difficulty finding waiters. If you take a look at how that's divided out, so these are, of course, the different waves. The first, second, and third is over here. We only have through January right now. We were updating that. And you take a look at what's happened, you can see that women were affected more than men were. Now, this happened for a number of reasons. The types of jobs that they do, the types of occupations in which they tended to be employed were more the places of employment that closed down. You also found that those who were harmed were those with lower salaries. They were the ones who went out to work, who lost their job more. And on average, women tend to have lower salaries than men. But that goes back to the other issue with respect to the jobs and the occupations. The same was true in the second shutdown. The same was true in the third shutdown. If you divide it by ages, you can see that the elderly were the ones who were harmed the most in the first shutdown. And that also has to do with people not wanting to take risks. Everybody was being told that the elderly were the ones who were in most danger. Employers didn't really want to keep them in jobs. The workers didn't really want to take the risk and stay in a job. This is people past retirement age. And therefore, they were the ones who were actually harmed the most in percentage terms. And then the young. And then the young, which is a lot of restaurant workers and people in those types of industries. If you take a look at the different populations, now this is only the men. This is only the males. Now, if you take a look among the men, the Haredi men were the ones who were harmed the most. We know that that those with low levels of education were the ones who were harmed the most. And the levels of education among the Haredi men is very, very low. Now, it's also low among the Arab Israelis. But what happened with the Arab Israelis is that many of them, a very large percentage, tend to work in building, in the construction industry. And in construction, a lot shut down in that first wave, but a lot less shut down in the second wave. And therefore, in the second wave, you no longer see what happened in the first wave. But the Haredi men lost their jobs and they weren't able to get new ones because they have very, very low training. They have a lot of years of education, but the education that they have does not give marketable skills. Studying Talmud doesn't teach you how to work in the modern workplace. If you take a look at the women, you have the same ordering, but the differences are much smaller because the Haredi women are much more skilled, have much higher training. That's more skilled. They have much higher training, many more years of education, of marketable education than the Haredi men do. So therefore, they weren't harmed as much. The reason that you do see, in any case, such a large percentage of Haredi women who lost their jobs is because of the fact that many of them work in part-time jobs, and those were the ones who tended to be let off more. If you take a look at the industries, so you can see in what industry, you can see some interesting differences between the first and the second shutdowns. You can see that in food, as I've been talking about until now, in wholesale and retail trade, you do have, and in education, because there were complete shutdown at the schools at the beginning, you do have a lot of people who were put on leave and didn't have a regular salary. That happened less in the second for some of them, for education, for construction. When you no longer shut down in the second shutdown, you find that the percentages are much smaller. And of course, when you look at the high tech, at information communications, at finance, at insurance, manufacturing, you have a lot less people who actually left their places of employment. Now, if you take so that takes you to the next issue, which is the issue of working from home. And that's going to be a big issue inside of Israel. It's going to be a big issue inside of a lot of places. We've learned to work remotely. And, this discussion we're having right now, a year ago, we wouldn't have done it. I would have come out to Washington. I would have met with you guys, and that would have been great. And we would have had, as the rabbi said before, some bagels and lox. But now we're doing it through Zoom. And I'm sitting in a room inside of my house, and you guys are all in your offices or inside your houses or wherever you are. And we're able to hold this. And we've learned to work remotely. We at the center basically closed down for the entire year. There were some people who came into the office and worked from the office, but we made sure everybody was set up with whatever they needed in order to be able to work remotely. And when you're doing research, you have no real problem working remotely. It saves a lot. For me personally, it saves a lot on travel time. And this week, for the first time, from Sunday, we have reopened our offices for everybody. So things are changing, but you can see that Israel, the percentage who generally work from home, has been lower than in the EU on average, but increasing significantly and closing that gap. If you take a look at what happened during the shutdowns and between the shutdowns, we have July here also. So you can see that in high tech, a very large percentage worked from home. Almost half the workers worked from home during the shutdown. In food and beverages, nobody did, because you're not able to do that. In construction, it's very hard to build a building while you're sitting in your living room. Maybe with new technologies you can do that. But you can see, in fact, that even after the shutdowns opened up, that 27% in high tech continued to work from home. And this was when everything was really opened up. And a lot of high tech companies, there was a survey among employers and asking, do you want your workers to continue working from home? Among the high tech companies, a lot of firms say they want many of their workers to continue working from home. Google's offices inside Tel Aviv have basically still not been opened up. They have a whole building there that's basically sitting empty. Not a whole building, a large part of a building that's sitting empty. Checkpoint, which is one of the largest employers in high tech inside of Israel, has allowed every worker to decide whether they want to work from home or not. And then they're changing the office space needs. That could have very large effects, by the way, in terms of real estate prices inside of the country, inside of the center of the country in particular. We don't know if that's going to happen yet, but if this continues, if working from home becomes much more viable and much more widespread, this could have some really, really, really major effects on the Israeli economy. It can have effects, for instance, let's take the Arab Israeli population who are living in the north of the country. They're living in villages where they're far away from the center of the country. And while during high school, they tend to learn a lot of computers and a lot of mathematics, when they then go to college, they'll go and they'll study education and they'll study paramedical type of studies, because that's where they know they can get a job. And that's where they know they can get a job staying near their home places, not having to move over to Tel Aviv or to Herzliya in order to do that. Well, if you would invest it in infrastructure in those areas, or if you do that, and working remotely becomes much more viable, then suddenly you're able to change the type of employment patterns that you're seeing inside of those communities. That can have a huge long-term effect. But when I think about real estate prices, I clearly see a situation where if there are enough people who are working remotely, they're going to want to start living in areas where they can afford better housing, not living in Tel Aviv. And maybe the demand for housing inside Tel Aviv might go down, and demand for housing outside in the periphery might go up. Improve the train system, improve public transportation, and you could have a huge effect on prices. And offices, Checkpoint is talking about lowering the number of offices that they rent. They just don't need it as much anymore. That can have a large effect. That'll be very interesting to follow to see what goes on. Take a look at who can. So this is a model that now predicts who can work from home. And you take a look at who can work from home. You can break that up by occupation, different occupations who can work from home and who can't. You can break it up also by the industry. And the industry, it actually meshes very well with what actually happened. That in those who are in food, nobody really worked from home. Those who are in information communication, we saw 27% work from home. This is in July after everything opened up. And then when you take a look and you divide that up according to different populations. So first of all, those with higher education are the ones, or above high school, are the ones who are more likely to be able to work remotely. The Arab population has very low probability of working remotely, given the types of jobs that they do. Those aren't the jobs that are going to allow them to work remotely. In other words, that's going to take a big shift in the types of skills that they're getting in order to allow a significant movement towards working remotely. The higher wage people are more likely to work remotely. And interestingly, the women with young children tend to be in occupations that allow them to work remotely more than men, and more than those who do not have young children. So that's obviously probably a market choice situation. And just going as a last slide, just to show you that issue I talked about with the infrastructures, you take, and this was done, this was actually looked at in order to understand the ability of learning from far, for education purposes, but it has just as much an effect on the ability to work from far. You have a large percentage of the Arab Israeli population who don't have computers or don't have internet or don't have at least one or the other. And among the Haredi population, it's also very large, but there you'll tell me, Dan in particular, I know you can tell me this, you can tell me that's by choice. You're right. That's by choice that that many of them do not want to bring that, that impure thing into their house. They don't want internet in their house. They don't want a computer in their house. And that's their choice. That's fine. That's not true among the Arab Israeli population. They do want that. They do want the technology. They do want the better paying jobs. And therefore, whatever you're going to say about one population is not necessarily true about the other one. That's what I prepared for you guys. I hope I chose interesting material because we have so much more that we could do.
I've got a question, if it's okay.
Of course.
So I wonder if you could comment on the impact of the rapprochement between Israel and some of its Arab neighbors on economic developments, on foreign investment or trade or whatever you think appropriate.
There has been actually with the UAE, there's been a lot of back and forth about a lot of cooperation. And it looks like there might be some significant investments made in the Israeli economy by people in the UAE that could be very, very beneficial for the country. For the most part, when you take a look at most of the Arab countries surrounding Israel and compare the products that are being produced and the products that are being consumed, you don't usually see a whole lot of of overlap. You don't usually see that the things that Israel produces are the ones that those in Jordan and Syria and Egypt, etc., want to consume, and vice versa. The things being produced there are the things that but high tech changes that, because the investments in high tech have become much more global. So therefore, I do think that that given the large interest in both countries of cooperating with each other, I think you do see a significant, at least probability of improvements in that field.
Thank you.
Sure.
That Avi, if I can, super interesting in many different directions. Just to pick out one, can you say a little bit more about the internal infrastructure? You were talking about high-speed internet in the north for the Arab villages. Say a little bit more about that, and then the probability of that actually being done in the political climate that Israel has right now.
Okay. Yes. There is definitely a relative lack in Bedouin areas and in the south and in the northern villages, which are more remote, with respect to internet infrastructure. That's something that has been improved significantly over time, but just not enough yet. Israel a number of years ago, I don't even remember exactly what year it was anymore, had allocated 15 billion shekel towards in what was called the Plan 922. That was just its running number in the Knesset, and it allocated 15 billion shekel to basically, and this was done together with the government, done together with the Arab parties inside the Knesset, with the United List, and basically they tried to address all of the major issues that were occurring, including infrastructures. Now, that doesn't mean that a lot more doesn't need to be done, and they are now talking that plan is reaching its end, and they're now talking about extending that and allocating new monies towards that. So I think that will happen in any government, independent of which government comes in. I think you're going to see an increase, in particular, given I don't know if a government's going to form now or not. I don't know if there's going to be yet another set of elections coming up in another 4 or 5 months. That could well happen. We just don't know at the moment if anybody's going to manage to put together a government. But whichever way it cuts, Israel has been much more aware of the needs of investing in those communities than it had in its first 60 years or so, because for a long time they were completely neglected, and that's obviously something that has been changing and needs to continue changing. And I think I really do think it's going to happen. I think it's happening, and it's going to happen more.
Avi, I'd like to ask you two questions, both of which have come up here in the United States. In looking at the numbers of people who've had COVID, the deaths are pretty obvious. You're either alive or you're dead. But in terms of people going into hospitals and testing positive and stuff, do you have information about false positives, false negatives, attribution of people's hospitalization and or death due to COVID, when in fact it was really a comorbidity that was a major influence?
Right.
That's my first question. If you would address that, then if I can, I'll ask a second.
Okay. So I don't actually know numbers on false positives, false negatives. You do hear anecdotal evidence, but I don't have any good numbers on that, on how many there have been. There have been some. It hasn't been a huge amount. It's been for the most part, they seem to have done a pretty good job. With respect to the morbidity in particular, when I showed those numbers with respect to excess morbidity, that was exactly why I didn't say morbidity due to COVID. I just said excess morbidity compared to the general trend of what's been happening in Israel, of what happens in every year in Israel. Now, when we looked at the numbers of how much excess morbidity there's been, it was fairly similar to what has been ascribed to COVID. The numbers weren't that different. It was inside the range. We gave a range of I think it was between 3,500 and or 4,000 and 5,000, and the number they were ascribing was 4,500 or something along those lines. It was right there in the middle of that range. So it doesn't seem, at least inside of Israel, like the numbers have been inflated in any way. Now there was a really interesting study, and I can find it for you and send it to you guys, that actually looked at a lot of different countries and basically measured excess morbidity in all those different countries. And what you clearly see, and what in particular looked at, not even excess morbidity, they looked at what is being ascribed to COVID versus what usually happens in those countries, and showing that there are many countries that have underreported excessively, many countries that have overreported like crazy, but in particular the ones who have gone down, who are not reporting, in particular non-OECD type countries, non-developed countries that are you just can't trust the numbers that are coming out of them.
Okay, my second question has to do with the law of unintended consequences. Do you track at all what impact COVID has had on people getting fewer mammograms or surgeries that are more than elective but not, critical, things like that, and what impact that has had?
Yes, we have looked at that a little bit. We're still looking at that, but that is something that we've been concerned with. And again, that goes back to the same answer I gave before about why we look at excess mortality in general, because we know, and we've talked about this a lot actually, but measuring it is more difficult. But you definitely do see people pushing off standard treatments, people pushing off checks that they would have done. This is particular early on. This isn't true anymore. We're in a situation now in Israel where all the COVID departments are being shut down, one after another, because they just don't need them anymore. But you did see, in particular, in those first months during that first wave, people not wanting to go anywhere near a hospital or anywhere near a doctor because they were afraid of what they would catch. And therefore, I wouldn't go and get an angiogram or whatever it is I needed to do because I was too afraid of what the consequences of that would be. So there was definitely a lot of that going on early on. And if you remember that spike that I showed you at the beginning in like March and April, there was a spike in that was very likely as a result of that, because there weren't many deaths from COVID. And therefore that was very likely people who were not taking care of things they should have taken care of. But we don't have the reason of death, that we can really say, but we can do it statistically. That's what we try to do.
Yeah.
Avi, I know the Abraham Accords have led to some investments especially in high tech. Has there been any collaboration among universities? Are there any academic exchanges that are going on between the universities?
I think it's starting a little bit. I know there has been discussion among universities of doing that. In fact, I know that there was a university that actually contacted the Taub Center about doing some joint work, joint research. It just wasn't a very good institute, unfortunately. So if it's not happening yet, I think it's happening a little bit, but I don't think it's happening a lot yet.
Okay.
I mean, there are departments that say we can arrange an exchange or whatever. We'll see how much that catches on. It's really interesting, that entire deal.
Very, yeah. We have at the in our MBA class, we have one or two Arab Israelis, and my sense is that they are well poised to take advantage of the Abraham Accords. And I know several consulting firms, management consulting firms, are trying to open up operations to take advantage of this. So hopefully it'll come to fruition. And as always, I enjoyed listening to you.
Thank you.
Well, I want to take the opportunity to also thank you so much for speaking. This was really interesting and I learned a lot. So I really appreciate you being able to take time of your day and speak to our group. So thank you so much. And Dennis, thank you so much for making this introduction to make this happen. And for all of you for being able to be here. And so if anyone has any final thoughts or questions, I am certainly not kicking anyone off immediately, but I do want to be conscious of the time and know that many of us have other meetings and appointments to get to soon.
And if anyone wants to send me, if you have any questions, you could just send me an email, drop me a mail, and I'll try to answer you and see if I can get you what you need.